Okay, we might get started. Welcome everyone to this webinar hosted in collaboration with the New South Wales P&C Federation, the New South Wales Department of Health and the New South Wales Department of Education. My name is Jason Wong. I am the Secretary of the New South Wales P&C Federation's Board of Directors and elected councillor for the North Sydney region. I'd like to acknowledge, in the spirit of reconciliation, the traditional custodians of country throughout Australia and their connections to land, sea and community, and pay our respect to elders past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander peoples today, including those that are joining us for this webinar. I myself am currently situated in Durham, Murrigaland, in the North Sydney area. So we're here tonight to learn a little bit more about a topic that has many parents and young people having lots of conversations about and struggling to get some informed advice about. As a lot of you probably would have heard, the number of young people that are vaping worldwide, really, not only just New South Wales, has increased significantly in the last few years. And more worrying is that the ages of the young people that are vaping is also getting younger. So tonight, we've put together a panel of speakers from different backgrounds to explore different perspectives of vaping. So getting straight into it, I'd like to welcome Dr Kerry Chant, the New South Wales Chief Health Officer and Deputy Secretary of Population and Public Health from New South Wales Health. I'd also like to welcome Kate, a young person that has lived experience with vaping. She's joining us from her holiday, so we really appreciate her giving up her time to talk to us tonight. We also have in the virtual room Dr Bronwyn Milne, the Head of Department Adolescent Medicine at the Sydney Children's Hospital Network, and Staff Specialist Paediatrician and Addiction Medicine Specialist. We also have the Chief Psychiatrist from New South Wales Health, Dr Murray Wright. Thank you for joining us as well. And from the Department of Education, we've got Renee West, PDHPE Curriculum Advisor 7 to 12 from the Curriculum and Reform Directorate. And from the New South Wales Ministry of Health, we've got Carolyn Murray, Director of Tobacco and E-Cigarette Strategy Unit and the Centre for Population Health. So the way that tonight's going to work is we're going to have some presentations from Dr Chant. Kate's going to speak to us, and then another presentation from Dr Milne. And then we will turn on the Q&A and answer as many of the questions that come through as we have time for, including those that some of you would have pre-submitted during registration. Before we get into the presentations, a little bit of housekeeping. You can probably see the Q&A button at the bottom of your Zoom screen. So please add your questions to that as you want to. There are going to be some people behind the scenes from the P&C Fed and the Department of Education who will be looking at the questions and trying to answer as many as possible and passing them on to the panel a bit later on. Your questions won't be visible to other attendees. FYI, we are recording tonight's webinar as well, and we will be sharing that recording with everyone that's registered. So, so if you have to check out halfway for any reason, never fear, you will get to see the rest of it later. And probably the last thing is that you can activate Zoom's live transcript feature. There should be an icon at the bottom of your screen which says enable auto transcription, if that might help you with webinar. So without further ado, I would like to invite Dr Kerry Chant to commence the presentations tonight. Thank you, Dr Chant.
Thanks very much, Jason. And before I begin, can I just acknowledge the traditional custodians of the lands on which we're all meeting and pay my respects to elders past, present and emerging. And thank you very much to the P&C for hosting tonight's event. If we can move on to the next slide. Next slide. So this graph shows current daily or occasional vape use in New South Wales by age, and I think you've probably had the lived experience of this amongst your networks, but vaping has been increasing in all age groups, but most rapidly in the age group of the 16 to 24-year-olds. So current vape use amongst our 16 to 24-year-olds has tripled to around 16.5% in 2021-22 from around 4.5% in 2019-20. And the latest Australian secondary students alcohol and drug survey conducted in 2022-23 also found that since around 2017, the number of Australian students who had vaped has more than doubled in those aged 12 to 15 years and those aged 16 to 17 years. Next slide. So why do young people vape? We know from research at in New South Wales that young people can access vaping products very easily through social networks such as Snapchat or retail stores, including tobacconists and convenience stores, and also from friends. Young people give flavour and taste as the primary reasons for vaping, and they also report the inconspicuous nature of vaping as appealing. If I can just comment on those flavour and taste, I'm going to show some pictures later on about some of the products, but clearly the marketing has been very much targeted to a young audience with guava, peach, pineapple, strawberry, fruit flavours, attractive colours, which really indicates the targeting of a younger age cohort. We also know that the colours and imagery are designed to appeal to young people. And as I've mentioned, those bright colours, stylish designs and images such as cartoons, and we've also seen some in the shape of things like sippy cups. Young people report that vaping addiction or vaping dependence is seen as problematic, but social use is considered to be acceptable. And I know some of the young people I've spoken to feel like the addiction component creeps up on them. They're not aware of how quickly they're becoming addicted and how that's then controlling, increasingly controlling their lives. Many young people who were ever vapers reported that they had used a vape they knew contained nicotine, and findings from the Generation Vape Research Project and anecdotal evidence from schools indicates widespread and easy access to vapes by young people and the social acceptability of vapes. So now if we look at the current access. So in New South Wales, it is illegal for anyone under the age of 18 years to be sold any e-cigarette products, regardless of whether it contains nicotine. So it's illegal for any retailer other than a pharmacy to sell nicotine e-cigarettes. And New South Wales health inspectors visit retailers to check compliance, and we're very guided by our health complaints portal. But it's clear that the supply is almost everywhere. It's very widespread, and hence that's led to a much strengthened regulatory environment. So the first step, I'm now going to talk about the next slide, which is the Commonwealth vaping reforms. So in May 2023, the Australian government announced a package of tobacco and e-cigarette reforms. And the intent of those reforms was to ban all e-cigarette products in the general retail market and only allow access to the products from an Australian pharmacy through a prescription pathway. Now, the first step has been to enforce border restrictions to prohibit the import of these products across the borders, and some of those initiatives started in 1st of January. And we're hoping that that will then stem the tide of products coming into the country. And then in March, we're expecting that the Commonwealth Government will introduce legislation that will then give effect to the ban. Obviously, we're working closely with our colleagues in the Australian Government, and then we will probably have to do some changes for our legislation to mirror or to support that Commonwealth legislation. In the meantime, we are still undertaking significant compliance and enforcement activity. And you've probably heard over recent weeks that we've had a number of blitzes in relation to, supported by police and our colleagues in the Therapeutic Goods Administration, a Commonwealth agency. So working in partnership to try and control the supply of these products. Next slide. So when we look at vaping related harms, it's important to know that all e-cigarette users are exposed to chemicals and toxins that have the potential to cause harms. So when someone uses an e-cigarette, the aerosol they inhale can contain over 200 chemicals. And some of these chemicals have been shown to be harmful to health and can cause cancer, heart disease, and lung damage. And then the other known health harms associated with vaping include throat irritation, breathlessness, cough, dizziness, headaches, nausea, and lung damage. And rechargeable vapes can also explode, causing serious burns and trauma. And nicotine itself can be poisoned, particularly if it's ingested inadvertently. Next slide. So most most of the vapes that are available and that young people are using contain nicotine. Now, they're not permitted to use nicotine. It often doesn't appear on their label, but when we've done some sampling of products that have been confiscated in our schools, it shows that I think well over 96% of those products contained nicotine. So clearly, young people are accessing those vapes that contain nicotine. Regular nicotine consumption by young people can result in changes to brain development, impair attention, learning, and memory, lead to mood changes, and increase stress, depression, and anxiety. And my colleagues online will be better qualified to talk about those factors. Nicotine is highly addictive, and regular use in adolescents can increase the risk of nicotine dependence and other substance use. And one of the things that we're really watching is the fact that many people that are going on from e-cigarettes will go on to smoke. And so we are very interested in its relationship to smoking as well. So when we look at next slide. So New South Wales has collaborated with others to develop a number of resources to support parents and carers. There is a vaping toolkit, which is available with a range of resources for young people, parents and carers, schools and health professionals. And these resources will continue to be updated as we see the evolution of the evidence. The new toolkit content, and you may have seen this at earlier versions of the toolkit, focus on areas of nicotine dependence, understanding the signs of withdrawal, coping strategies, and how to quit vaping has been added. We've also introduced new supporting resources for parents and carers. Some of those resources are in development, but there are some resources around how to have the conversations and some practical ideas. And again, my colleagues will talk about those more practical concepts of what to do if your child is vaping. A resource hub has been added with links to evidence-based practical resources from other organisations that we think will also assist parents and carers and young people. Clearly, we're committed in New South Wales Health to work in partnership with the Department of Education. We have been working with the Department of Education in curriculum development area to support young people to be aware of age-appropriate awareness of e-cigarettes. Also, we participate in the Vaping in Schools Roundtable convened by the Deputy Premier. And we're also supporting the development and co-design of additional resources to support teachers and school staff. And one of the final things that we've recently launched is a new campaign that's targeted at young people. So we're now just going to go through vaping insights from some personal experience. And one of the key issues is providing evidence-based and relevant messages targeted to young people is a crucial part of our approach. And so we have recently launched, as I mentioned, the campaign, Every Vape is a Hit to Your Health. And the target audience for that is around 14 to 24 years in age in New South Wales. And the campaign utilises powerful creative to encourage young people to consider the proven health harms of vaping. And I'm pleased to say it was developed in consultation with young people and medical experts, and includes testimonial videos of young people who have experienced the harms of vaping. And I've got to say that the response when our Cancer Institute did a call out for young people to help and work with us on this topic, we were very overwhelmed by the willingness of young people to step forward. And I'm incredibly grateful for those that have participated in the campaign and those that are continuing wanting to work with us to evolve our resources. And now I'm pleased to introduce Kate tonight, who is one of the young people featured in the campaign. And thank you very much for giving up part of your holiday evening. But Kate will share her story about vaping. Kate, you might be on mute.
Oh, hello. Hi. Sorry about that. Hi, everyone. I'm Kate. I'm 20 years old. I started vaping when I was 16 and I vaped for 2 years. I was first introduced to vaping by a friend who was the same age as me, 16, a friend I met at school, who had bought a vape from a local tobacconist and gave it to me as a gift because he didn't like the flavor. So when I first started, I was not aware that there was even nicotine in the vape. And I was hooked on it pretty much straight away. I would vape all the time. I would vape at school, in the bathrooms, at lunchtime, even during classes. And this was something that was all of my friends at school were doing it. It was very socially acceptable. And that also started with me vaping at home. I would vape in my bedroom while my mum was, downstairs. And I would vape all the time. It was a constant thing for me. And of course, my parents did end up finding out. And I tried to brush it off. I said, oh, well, it doesn't have any nicotine in it. And it's just like flavored air. And it's better than smoking, and all of my friends are doing it, and kind of brushing it off like it was kind of this high school phase that I was going through, and I'll quit when I finish school. But then when I did move out of home, I continued to vape. It was like a very big part of my social life. They were very cheap and very affordable, so easy for me to get. And it was just kind of a constant thing for me. So it would be the first thing when I woke up, the last thing I did before I went to bed. I had the vape on my bedside table, ready to go at all times. And I was obviously very addicted. And when I wasn't around my vape, I was irritable and anxious, and I had uneasy feelings, but I kind of tried to ignore that. I didn't want to admit to myself that I was that dependent on the vape. But then one morning I woke up and I had some bad lung pain. I was having difficulty breathing and like tightness in my chest. So I went to my GP and he pretty much rushed me off to hospital straight away. And it was there that the doctors told me that I had fluid in my lungs and I had pneumonia that was most likely caused from me constantly vaping for 2 years. So that was a really scary wake-up call. That's when I knew that I had to quit. For me, I quit cold turkey, and it was one of the hardest things I've ever had to do. I still remember me sitting on my bed, just like shaking and having all these horrible withdrawal symptoms. I was so irritable, and my friends still tell me that I was awful to be around for about 2 weeks, which is part of the reason why I'm really happy to be part of this campaign. So other people can know that it is possible to quit, because I feel so much better now. And also be able to share my story and have young people hear other people's real stories about the negative side effects of vaping. So I'm very pleased to announce this campaign. Thank you.
When I started vaping, my breaths weren't as deep.
I tried to take a deep breath in. It was like my lungs were squeezing in on themselves.
Just getting out of high school, there I am with like the worst breathing I've ever had in my life.
I barely walk up the stairs without struggling to breathe. I'm so much happier now that I've quit. My health, everything overall has become so much better.
I can take deep breaths now without getting pains in my chest.
Never touch a vape again. It's just not worth it.
Every vape is a hit to your health. For more proof, search vaping harms.
Wow, thank you so much, Kate. That was so fantastic to hear from you and to hear your story. Hi, my name's Bronwyn Milne, as introduced by Jason. Thank you for that introduction, and thank you also to the PNC Federation for this opportunity to speak to you tonight. I'm a paediatrician and addiction specialist. I work with young people with substance abuse, and vaping, as we have heard, is a really big issue for young people today. Thanks. We'll go to the next slide. So you look, it's really important for parents and carers to understand the impact of nicotine on adolescents, particularly on the adolescent brain. And we know that nicotine rewires the young person's brain at a time that is really crucial when there is so much growth and development in the brain. We know that nicotine affects us physiologically, just like Kate explained, actually. And for parents and carers and teachers, if we can understand how nicotine impacts the body and affects the body from a physiological perspective, it can really help us be able to help young people, particularly when they're ready to quit or when they're in that cycle of nicotine dependence. So we know that nicotine works on the receptors in the brain, releasing the chemical dopamine. And dopamine is that feel-good chemical that makes you, gives a pleasurable response. And that's often a big part of that nicotine addiction, particularly in the early stages. We know that the adolescent brain is neuroplastic, which means that it's changing. The structure can be adapted by the environmental factors, and nicotine can play a harmful part in that. And vapes, we know, can deliver nicotine at quite high doses, and in some cases, really give that nicotine in a rapid response, just like cigarettes, or even more rapid. New South Wales Health and the Your Room website has also got some really great little videos that explains how easily nicotine impacts the brain. So we'd like to share this one with you.
Strawberry Crush, Blueberry Ice. Sounds delicious, but vaping isn't all it's cracked up to be. When you vape, you can inhale over 200 different chemicals that irritate and damage your throat and lungs. Most vapes contain nicotine. Small disposable vapes can have as much as 50 cigarettes worth. Too much can cause nausea, headaches, and anxiety, and in some cases even seizures. Nicotine is highly addictive and tricks you into using more. The first feeling you get is only temporary. Over time, your brain changes, making you want to vape more and more to get the same feeling. If you're under 25, vaping can rewire your brain and make you more likely to get addicted to nicotine and other drugs. Respect your brain.
Thank you. Becoming addicted to nicotine can happen really quickly, just as Kate explained to us, particularly in young people, particularly for the adolescent. Nicotine is one of the most addictive substances in the world, and you don't actually have to even vape daily to become nicotine addicted or dependent. There are lots of signs that you or a friend or a young person might become addicted to nicotine, and that includes vaping as soon as you wake up in the morning. We've got here within 30 minutes, but often it can be within the first few minutes of waking. Vaping alone, initially perhaps vaping with friends, but then starting to use the vape alone. Finding it hard to concentrate, particularly if you haven't vaped recently, and having that addiction or cravings, becoming irritable and moody or stressed or anxious when you don't have a vape. Other things like being difficult not vaping in places when you're not allowed to, like school or the school bus or other places, and being discreet and hiding the vape. Perhaps even having a quit attempt but not being able to quit even when you wanted to. Always having a vape on you, never leaving the house or being without it at any time. So all of those signs can show us that there is nicotine dependence or addiction. So it's important for us as parents and adults and carers and teachers to be able to have some strategies and to have some strategies and tips and tricks so that we can help support young people when talking about vaping. We know that, as Kerry talked about, Dr. Chant spoke that the vapes will become restricted in the future, which means, we need to have these tools on board for us to be able to help young people. Being non-judgmental is really important so that we can understand the issue, understanding the facts about what's in a vape, how it works, the nicotine impact on the body and the brain is really important. And actually sometimes young people, although they may be aware, they're not acutely focusing or thinking about those impacts on their body. Also, knowing the facts about vapes and the role of the tobacco companies in targeting youth. As we can see, these vapes are in bright colours, interesting flavours, really in the great shapes and sizes that are appealing to young people. We know that the adolescent stage of development is a time of risk-taking, and that's normal for young people. And the influence of their peers, and friends is part of the normal development, but how parents can come alongside their teenager to help support them through that normal stage of development. For parents, having the right time to have that conversation is really important so that it can be a calm environment, and avoiding judgment, avoid the lecturing, but really coming alongside to help champion your teenagers to be able to be empowered about their health and to make positive health choices. I think it is really good for parents to be able to explain their concerns for a young person and, to really provide some supports to help them quit. And this is a great slide which shows some really practical tips that we can give to young people to help them if they're ready to quit. Choosing a quit date is a great plan. Perhaps make it a low stress time, not in the middle of exams or not at a time that is, other stresses in life, but having a plan around how to manage those withdrawal symptoms if they are something that the young person struggles with. One really great tip is getting rid of the old vapes. Many young people will hide or store all of the old vapes so that they can see the colours and the shapes and the flavours and what have you, and even sucking on those vapes when they're finished. So getting rid of those vapes, getting rid of the triggers, or knowing what the triggers are, and having some strategies around how to manage those triggers. Telling your friends and family and having some positive support around. Some young people might like to talk to their friends and actually make some plan to quit together so that they're all in it together. Letting your friends know that you are about to quit or you are in the middle of quitting. As Kate beautifully explained, her friends, noted this change, of the real struggle after quitting, that irritability for a couple of weeks. But if people are aware of that, then they can help support. And knowing that there is help available, and we'll talk later about who is around, and working with health professionals to be able to seek support. Nicotine withdrawal can look like many different things. It can cause irritability, can impact mood, it can impact a young person's ability to concentrate, focus at school or work. It can trigger feelings of anxiety and restlessness, or feeling jittery, impacting sleep. Also, even, if nicotine had suppressed appetite, it can make young people feel more hungry than usual. And really those thoughts of cravings, not being able to focus on anything else other than vaping. And, these symptoms can sometimes be tricky to decipher, is because it may look like other mental health issues. It may look like anxiety or depression, might just be labelled as an irritable, cranky teenager. Knowing what's been going on with the vapes and how often a young person is vaping helps you, potentially identify these symptoms. There are lots of practical strategies that we can suggest to help young people to cope with the urge to vape, but also to manage some of those withdrawal symptoms, and healthier ways to manage the stress. Being active is a really great one. And the reason is, when you exercise, the brain also releases those feel-good chemicals like the dopamine that makes you feel good. And for young people, it's really important to keep busy, be active, plan your day, have some scheduling. When a teenager is bored, of course, they can get up to all sorts of mischief. And for someone who has trying to quit or cut down, being bored can trigger that relapse, and it can be really difficult. But incorporating fun things into their day and into their schedule. We talked about this before, but talking with friends and families and having loved ones support them go through this. Carrying a snack is one great tip, but I spoke to a young person last week, and she said icy cold water was the thing that she used to help her when she was struggling with the cravings. And instead of reaching for a vape, she had her bottle of icy cold water, which was really helping her. Using other distraction techniques and calling out for help, getting some help from those around. Dr. Chant has already mentioned that cycle of stress and anxiety and nicotine dependence, and it really is, a tricky place for young people to be, particularly if managing anxiety was one of the reasons for either commencing a vaping or continuing with the vaping. We know that nicotine addiction is linked to increased stress and can worsen anxiety and depression. And we also know, as Kate explained, and as we know about nicotine withdrawal symptoms, can trigger anxiety, make you feel irritable and restless and unsettled, and impact the mood. So this becomes a really vicious cycle, and it's counterproductive. So encouraging your teenager to be aware of this, to reflect on what's going on for them, and to look after their mental health is really important. Being able to talk to them about these things and what's going on, helping them keep track of their mood is a really great way for them to help look at the ups and downs, and seek support when they're worried, for so that they can actually have some others help them along this journey. So this slide just outlines who is available. I think your general practitioner is a great first start. Reach out to your GP, because you can talk to your doctor about the nicotine or about the vapes, some strategies to help, and also to look at if there's other things going on. Perhaps there is, some anxiety or mood or depression or other things. We also know that young people who vape may also increase risk of smoking cigarettes or even other substances. So it's great to get some health support. Support in schools is also a great option. Perhaps a school counsellor, or a number of schools have wellbeing health in-reach nurses who are available for support. And the quit line, you can see the number on the screen there. The quit line is a great resource that you can call, or perhaps even go online, and then you can request a call back. And it is staffed by qualified health professionals with specialist training who can help young people quit vaping and smoking. And there's also targeted support with the Quit line for Aboriginal people and also those from cultural and linguistically diverse background. So that's a really good support. And of course, if there's other, mental health issues going on, Headspace is fantastic for young people. And then, of course, there's a mental health line and kids helpline numbers on the screen there, which are also a great resource. So thank you. That's I think that's a summary of who is around that's able to help support yourself and your teenager or those that you know who may be struggling with vaping or nicotine dependence. Thanks.
So thank you very much, Dr. Milne, and thank you to Dr. Chant earlier for presenting data and evidence from your research findings in areas of expertise that I'm sure a lot of us weren't fully aware of. But a super big thanks to Kate again for telling us your story, your lived experience, how you got through it, obviously what it was like when you were in the middle of the addiction. But I guess significantly giving all us parents and carers hope that our kids can get through it. So that was really comforting to hear. So we are going to go to the Q&A section now. So if I can ask all the panelists to turn on their, at least their videos and their mics when I call to you. I'm sort of just been going through the questions to try and find ones that are relevant to what we've been speaking about, and some which may not have been addressed completely in the presentation. So I might, let's see, I might go with, look, I know, Renee, you've been sitting there waiting in the wings, eager to chat. So I'm going to go to you first, Renee, from the Department of Education. What are schools doing to help stop the prevalence of vaping? And what are the punishments if students are caught vaping?
Yeah, common question. Thanks, Jason, and thanks to the P&C Federation for having us here tonight. We really appreciate it. Look, schools are doing everything that they can. As we've heard, it is a community issue, and schools are doing what they can within their broader community to be able to address vaping. The department is focused on educating the whole school community. That's our core business, particularly around the harms of vaping, the benefits of not vaping, the skills to reject vapes, support their friends to stop vaping where that occurs. And Dr. Chant spoke about the partnership that we have with New South Wales Health earlier on. Part of our response is obviously starting with students. So, we provide mandatory drug education to every student from kindergarten to the end of year 12 within department schools. That has a focus on e-cigarettes and vapes. And within the department, we provide the resourcing. So the curriculum development that Dr. Chant talked about, that resourcing is important for our teachers to feel skilled and confident to be able to present the learning for students. And that learning is not just focused on knowledge, it's focused on building their skills and their skills to be able to, confidently reject vaping, but also to be able to decipher the messages. Because as we heard, marketing is a really big part of this and social media is a really big part of this. So a lot of our curriculum resources that we developed in consultation with New South Wales Health around the campaign messages really try and unpack some of those marketing strategies. We upskill our staff as much as we can, and the more we learn about vapes, the more we upskill our staff. And most recently, our professional learning and our trainings moved beyond just how do we deliver this in curriculum. We've worked with the Cancer Institute to create an online training resource, and that is focused on upskilling teachers, leaders, and any school-based staff who are working with students to be able to not just understand what vapes are and the health risks that are attached to it, but to be able to use a model that is used widely within health circles, so ask, advise and help, to be able to assess the need of the student and then to be able to provide some support around the health response for that student. It also upskills our staff to be able to talk with parents and carers, and I think that's a really important thing. And Bronwyn just talked about the school as a support. So sometimes where do you start? Maybe it is the school. And getting a little bit of advice around that. And, we're here, we're doing what we can to upskill parents and educate parents. We're really proud to be part of this. We did one last year. We're working closely with New South Wales Health to disseminate information and promote campaign materials, as well as fact sheets, and have those conversations at a school level. What are the punishments? Well, it is let's remember it's a health issue. So we need a health response. We need a health and wellbeing response in our schools. So it's not all about punishing kids. This is broader than the student. We have updated our behaviour code. We do have a drugs in schools policy. Vapes are not allowed on school grounds, and that is very clear. And ultimately, it comes to the principal. So principals have a range of measures that they can use when they're responding to this if it's a behaviour concern. There's a different response in caught with a vape and using a vape compared to caught with a vape and selling a vape, obviously, within the school grounds. And the policy will provide, and particularly the behaviour policy and suspension policy provides the guidance for principals to make those judgments. The emphasis is on continuing that education pathway. The emphasis is on providing support for the parents and carers and providing support for the student. So making sure that the wellbeing or the health response is wrapped around that student as much as the behaviour response. So it might be a detention, it might be that suspension is used, and keep in mind that the purpose of a suspension is really to allow the school to put some supports in place. All right, so it's taking a child out of the classroom, and it's to be able to look at what that complex and challenging behaviour is and be able to respond to that. And Bronwyn just talked about the wellbeing health in reach nurse coordinators. They're there as well, offering support in the schools that they're in to be able to facilitate the access to healthcare services. So the departments and schools are certainly doing what we can and working with key partners as much as we can to be able to respond to the situation that's occurring for young people.
Thanks, Renee. I think we've heard obviously quite a bit about the physical health risks of vaping, and but towards the end of your answer, then Renee, you started touching on some of the mental health risks as well. So I'm going to throw to Dr. Murray Wright for this question because I can see he's eager to get involved as well. So Dr. Wright, so parents and carers are hearing that our kids have to vape to deal with anxiety in its different forms. As parents, what do you do if there are underlying mental health issues that are often leading kids to start vaping in the first place?
Yeah, look, I think that's a really important question, and I guess it's a source of worry to many parents. Is this a piece of normal adolescent experimentation, which is being driven by peer pressure and other things, or is there something more sinister underlying it, which is causing the person to take up something which is potentially addictive? I think that most adolescents that I've ever met would tell me that they are stressed about something or other, and so I think that I think it's stress, not anxiety, for many people, and I do make a distinction there. But the real difficulty that we have, which I think Bronwyn outlined really neatly, is the vicious circle. Is that whatever the reason people start doing something which involves a chemical as addictive as nicotine, once they do it, they develop all the hallmarks of what looks like a mental health condition just through the addiction. And so when we have someone who is addicted to nicotine from whatever cause, whether it's vaping or anything else, the first task is to actually sit down and talk with the person about what is actually happening. And again, I think the slides that Bronwyn showed are really, really helpful, because the steps, and also what Kate had to tell us about what happened when you started vaping. I mean, that's Kate, you're a textbook example of some of the features of what happens when you're addicted. It's the first thing you think about in the morning. It's the last thing you do at night. You put aside other activities and responsibilities because the vaping becomes more important. I think explaining all of that and educating the young person as to the fact that regardless of how it started, it's now taken over their life. There's an addiction, and that in dealing with it and in trying to deal with it, and I dare say many young people have already tried to cut back and have become scared by some of the withdrawal symptoms that they've experienced. And I've met a lot of people who've had those sorts of addictions, and they've said to me, no, I think I'm self-medicating my anxiety disorder, because every time I try and cut back, all these anxiety symptoms come up. And so educating the person and saying, if you're getting these symptoms straight away when you cut back, it's almost certainly a withdrawal effect. And the strategies, again, that Bronwyn outlined about how to plan a withdrawal and how to support yourself and how to support other people through a withdrawal becomes really important. There will be some individuals who may have shown other signs of a risk of depression or anxiety, and we shouldn't ignore that. We all know that adolescence, particularly late adolescence, is a time when some of these conditions show up for the first time. But the good news is that if someone's addicted to vaping, the process for managing the withdrawal is the same as the process for the initial treatment of anxiety and depression. So there's no distinction. Being active, structuring your time, getting support, looking after your general health, all of those things are what we do for emerging anxiety and depression. We don't rush off and start people on antidepressants. And so the task for the young person, for their parents, and for their health practitioner is to explain and then to sit with them as they go through that withdrawal process and help them to tough it out. Again, Kate gave us a pretty good account of just how difficult it is and how important it is that the people around you have that awareness that this is going to be a tough time, but you need to get through it. So I think that and then what happens after that is that in the vast majority, a lot of those anxiety and depressive symptoms will fade away as the withdrawal wears off. There will be a small percentage where there are lingering and significant symptoms of either anxiety or depression, and that's the point at which seeking the kind of advice that Bronwyn put up in that last slide also becomes helpful. But the first step is getting through that withdrawal process and trying to see what's underlying it.
Thanks, Dr. Wright. Yes, definitely my experience at my kids' school has been addressing the underlying issues around mental health and anxiety and learning and motivation issues has gone a long way to making vaping, as he said, a bit of a non-issue now, although, yeah, definitely this time last year was something he was definitely tearing his hair out about. I think with this next question, and again, sort of following on from what you just said then, Dr. Wright, about having the right people around you to support you, I'm going to go to Kate, actually, and ask you about peer pressure. What role did your peers have in I guess commencing and maintaining your vaping issue? I mean, you mentioned earlier you got your first vape as a gift from a well-meaning friend, but yeah, tell us a bit more about how you got through that, please.
Yeah, well, I think the friends and the people around you, it definitely plays a massive role in the vaping and the addiction. I was introduced to vaping first by someone who was a friend at the time who maybe wasn't really looking out for me, but it was also just such a normalized part of going out and being with friends, and it was just this normal thing. And especially with vaping, I know with my friends, and kind of cigarettes were seen as this kind of lame thing, and vaping was never really seen like that. I think friends also play a massive role in a positive way though as well, because when I had to quit and it was the worst, I was very lucky to have friends that were supportive And even if they weren't ready to quit, they would make the effort to not vape in front of me and not make it harder for me, which is a massive thing. So I do think that friends play a big role in vaping and in quitting, and yeah.
No, thanks, Kate. That's yeah, reinforces what we've been saying about that support network around you. Carolyn, haven't forgotten about you. You're going to get a double-barrel question here. So we had a question about vaping on transport, public transport. So if you could give us some idea of what are the rules around this, and what measures in general is the government taking to prevent kids from accessing vapes?
Thanks, Jason.
You're still on mute. Well, you weren't, and then you were.
Can you hear me now? I guess one of the things I'd like to say up front is that we've got a very active compliance and enforcement program here in New South Wales Health. We have a team of people that walk around the state and look at retailers and people that are doing the wrong thing, so selling them to young people, for example, and inspecting their premises. So that's where I'd like to start, is that we do have a team of people doing that work. This ensures that young people are less likely to get their hands on the vapes. But as we know, there's lots of stores selling them at the moment. In terms of the public transport issue, it's a very good question, and we've been working with New South Wales Transport on this issue lately. And they've designed a whole campaign around you can't vape where you can't smoke. And that's also been utilised on public transport, including on buses, which is, I think, where the question came from. Part of the question was what the young person should do on a bus if they see someone vaping. And I think the best thing to do would be to, once they take the number of the bus and once they get off the bus, ring 131 500 and report that bus number to New South Wales Transport, and they'll take the issue from there, because every bus, as you know, has a camera, etc. on it, and they'll manage the issue from there. So I'd advise the young person to do that rather than speak to the bus driver or the person at this stage. In terms of, I guess, the other work that we've been doing in the retail inspections that I referred to, we've seized over 400,000 e-cigarettes from stores. We continue to do that. The team have been doing that this week, and they will continue to do that every week until we see an impact for our young people. I think that most people on the call here have talked about the challenges for young people, the design of the vapes to target young people. We're well aware of that, and as is our team, and they work very hard to get these things off the streets. Thanks.
Thanks, Carolyn. I think this next question is something which we often hear the word bathroom every time we hear about vaping at school. So probably Renee's the best person to ask this question. What's the general school approach to managing students vaping in bathrooms, and are vape detectors being considered?
Yeah, it's a good question, Jason. Look, I mean, outside of the health impact that's happening, when we talk about schools, e-cigarettes are a distraction and they're a disruption. Teachers have a duty of care, and monitoring anywhere within the school grounds is part of that duty of care. So, you know, systematic checking of facilities and school ovals and other spaces is part of a teacher's supervision during playground duty. So they will supervise toilets and they will supervise spaces. And we know that young people are creative, and they'll find spaces that they can hide in where less teachers can get to, or the most distant spaces within, I guess, within schools, to be able to make it more difficult for teachers on playground duty to be able to cover the broad space that exists within schools. I mean, outside of break time, schools do try to do what they can to reduce congregation and gathering of students in school toilets or facilities. So they'll make decisions. When we had the roundtable, the vaping roundtable, and we had key stakeholders there, we did hear about single cubicle toilets in some schools and the benefit of that, not just for reduction of vaping and drug related issues that might occur in schools, but also for other social issues like bullying. So it is something that has come up within that roundtable, and it's something that the department will take away and investigate. Certainly within within future builds, it can be something that we can have a look at, whether it is the evidence is there. Teachers are, I think the thing to get across is teachers are really concerned about the perceived role that they have in monitoring the use of vapes in schools. It adds to their workload, and the difficulty with that is it takes away from their core business of teaching and learning. And it also reduces a teacher's ability to be able to develop positive relationships with students, and that's crucial for effective teaching and learning to occur in schools. So it is having a major impact on staff within schools. They don't want to be the vape police. They've said that really clearly. It's a community issue. They're doing everything that they can. And the reduction of access to these devices, as Carolyn's just talked about, will have a huge impact within the school gates, so teachers can get back to that. Vape detectors comes up often. The department is looking at a range of interventions to address vaping within schools. Vape detectors has been one of many interventions that we've investigated. But again, when we hosted the vaping roundtable and the Deputy Premier and the Minister for Health were present, at those events, we had experts across health. We had academia there. We had representatives from schools. We had school community representatives there. We had the P&C Federation, that were there. We had the Secondary Principals Council, Primary Principals Council, people we wanted to hear from. And the evidence that we heard was that the effectiveness of detectors to reduce the prevalence, it wasn't enough evidence to indicate that detectors were the solution. Where they have been put in schools, it's impacting on supervision. It's moving students out of the toilets, where there is a safety issue and students are feeling unsafe. That has been a positive, but most schools have adjusted supervision to try and increase that. I think the thing to think about with detectors is why they're being installed and the purpose for their installation. And outside of the cybersecurity issues that might occur with them, outside of the graffiti and damage that sometimes has occurred with them, outside of the fact that we've now got some plumbing issues in some schools where students are rushing to get rid of vapes and that's causing more issues. There were some negative health effects that we discussed where students were seeing trends on social media, because social media is their life, around holding the vapor in. So trying to beat the detector. So don't release the vapor so the detector's not picking it up. And, those sorts of things, alarmed everybody within the room. So schools are able to install vape detectors if they see that vaping is an issue, and it is at their own expense to do that. And some schools have done that, and some schools are talking about how that is working, but it also needs human intervention and it needs greater support wrapped around it. So it's not a one-stop shop to solve the problem in any school.
Thanks, Renee. That's very informative. We probably got time for a couple more questions. I'm going to shoot one to Dr. Milne first. So how do I support my child to say no and to quit even when their friends are vaping?
Oh, that's a tricky one, isn't it? Look, I think we need to start the conversation early. I think we know that vaping has been increasing issue over the last 6 to 7 years. So this generation of kids who are in high school at the moment, it has been part of their world. We need to be speaking to the younger kids, in primary school, so that they can be informed, have the facts, to be empowered to make positive health choices. I think when, being aware of that peer influence and how important that is for your child is important, but also empowering them to be able to make their own choices, to reflect on, the importance of their own health. If they are ready to make a choice to quit, or, really trying to cut down or to say no, actually running through some scenarios is a really practical thing you can do with your child or, teenager, helping them come up with some one-liners, some excuses. You know, no, sorry, I'm not doing that anymore. Or no, sorry, I don't, you know, it gives me a headache. Or actually, I'm not going to waste my money anymore. Or I'm making some better choices. Or if it's, you know, affected my lungs and I'm not interested anymore. So helping young people so that they're not on the spot feeling, you know, pressured by their friends, but they've got a pre-prepared answer that they can pull out, you know, when they're with friends. So I think talking about it early, you know, earlier prevention is better, giving them some strategies, helping young people to be empowered, you know, for their own health.
Thanks, Dr. Milne. We are going to have to wrap up soon, so I've just got one last question for Dr. Chant. What are the effects of secondhand vape on other members of the family and those who are around when vapers are vaping?
So look, there isn't a lot of literature on this at the moment, but maybe if we just go back to first principles, that part of the concern about why we're setting up policies not to vape in areas is because of the normalisation of vaping and smoking, and we see both as harmful for the individual. In terms of settings, we know that vaping does generate particles in the air, and so in indoor closed environments with lots of people vaping, it's likely to generate particles, and we know those things can cause harms. So an emerging area, I would hate to oversell the evidence for it one way or the other, but we'll keep you updated as that literature emerges.
Great, thanks for that, Dr. Chant. Well, that brings us to an end to our webinar. I'd like to thank all the speakers and panelists again. I think we heard a lot of information about the health risks, both physical and mental, and hopefully picked up some strategies that we can all use as parents and carers to tackle what is, you know, ultimately a whole of society issue. I think we've sort of recognised that the Department of Education and the Department of Health play key roles in this, but I think all the parents and carers that came to this webinar tonight came with a spirit of collaboration and with a desire to actually understand, well, what is our role in this? What can we do? Because this issue is big and it's only getting bigger. So I'll just finish off with a little bit of information. So for more facts and information for parents and carers and also for young people, Dr. Chan in her presentation mentioned the New South Wales Health Vaping Toolkit. That's available via the link which is on the screen now. In addition, the P&C Federation is working with New South Wales Health to develop additional parent and carer specific resources that will have a focus on nicotine addiction and what we can do to support our young people with this issue. And these will be communicated when they are available in the not too distant future. Last thing would be that we'd appreciate your feedback via a survey on tonight's webinar. A link for that should be appearing any second now as well. It will, if I can't see it, but if it hasn't appeared, obviously everyone that registered will be sent a follow-up email with the link to the recording of this webinar, so you can watch it again, especially if you might want to have a look at some of the slides that were presented. Thank you again for coming. Hopefully you found it informative and engaging and inspires you to take some action. And good night. Enjoy the rest of the evening and see you hopefully in the next webinar. Bye.